Walk into almost any growing medical clinic on a Tuesday morning, and you will see a front desk stretched to its absolute limit. Phones ring, paperwork piles up, and staff scramble to manage a constantly shifting schedule. Medical assistant jobs are projected to grow 15% over the next decade. Patient demand is surging, but the supply of qualified talent available to manage that demand remains incredibly tight. When your team is simultaneously juggling scheduling, insurance calls, and intake forms, things slip. Calls drop to voicemail, vital appointment slots sit empty, frustrated patients look elsewhere. This ongoing struggle to manage the front desk is built into the traditional practice model. You hire, you train, and inevitably someone leaves. Front office support staff see a 40% annual turnover rate, outpacing clinical roles. This turn costs the practice $9,000 to $12,000 per replaced role. Meanwhile, manual insurance verification consumes 30 to 45 minutes per patient. When staff are rushed through that verification process, an average of 18% of patients end up with incorrect insurance information on file. That directly triggers claim denials and stalls your revenue cycle. Clinics are paying premium replacement costs to maintain an inefficient intake system that actively slows down their ability to get paid. This timeline tracks a clinical practice that abandoned the constant hiring cycle. It begins February 2025. Instead of searching locally, they onboarded 3 highly trained offshore medical schedulers. These professionals instantly stabilized appointment workflows, requiring 0 ramp-up time. 2 months later, they expanded the scope. They deployed a dedicated benefits verification team with strict daily targets of 30 entries per team member. By enforcing those structured targets and implementing multi-layer quality assurance, the practice entirely removed that 45-minute per patient verification burden from their in-house clinical team. They proved that outsourced human workflows could operate flawlessly. That operational success built the institutional trust required to attempt the next logical step. 14 months into the engagement, the practice deployed an AI voice bot. Integrated directly into their phone system, this tool instantly scaled to handle 20 simultaneous inbound patient calls. The bot takes on the greetings, manages basic clinical triage, answers frequently asked questions, and seamlessly switches between caller languages. During peak hours, the clinic stopped missing calls. 0 patients were left abandoned on hold, waiting for an overstressed receptionist to pick up. Communication capacity is no longer tied to how many receptionists are sitting at the desk. The technology handles the volume spikes automatically. This flowchart maps out the final phase, back-office automation. By April 2026, the practice had built complex N8N workflows, a tool that connects different software applications together to process repetitive tasks like prior authorizations automatically. A clear division of labor emerged. Software scripts process the massive volume of structured, repetitive data. Complex situations and nuanced patient interactions are routed directly to human staff. All of these touchpoints feed into an integrated CRM system, ensuring practice managers have total visibility and perfectly tracked records for every single client interaction. AI isn't pushing human workers out of the clinic. It is stripping away the repetitive data entry so clinical staff can actually spend their time treating patients. Let's look at the financials. This scale illustrates the difference between paying $30 to $45 per hour for a fully loaded in-house employee compared to securing highly trained offshore professionals starting at $8 to $10 per hour. And every element of this ecosystem, the human staff, the voice bots, and the cloud infrastructure, was deployed under strict HIPAA, SOC 2, and HITRUST compliance standards. Multi-provider practices are achieving up to a 70% reduction in their administrative costs while completely maintaining their data security and specialty expertise. You don't need to build an advanced automation ecosystem by tomorrow morning. You just need a solid, sequenced starting point to clear your immediate bottlenecks. Staffingly Inc. is the specialized outsourcing partner that built this blueprint. They have transitioned over 800 healthcare providers, and new clients can go live within 48 to 72 hours with a 2-week risk-free pilot. When patient demand outpaces your front desk, hiring another receptionist is a temporary patch. Permanently clearing the backlog requires choosing the right architecture to scale your operations intelligently.